All right, hello. It's Art. I'm back again. Welcome to Southern Nevada CERT. And this morning we're going to talk about triage. In your books, it doesn't really talk about the triage method too much in your books, but it's something that we're supplementing because we think it's very important here in Nevada CERT. So we're going to supplement it as an additional lesson to teach you guys. Okay. So triage, what is it? Okay, it explains a little bit. Basically, it's a rapid assessment of your patient in a mass casualty incident. What is a mass casualty incident? Well, you talked about seeing in your lesson that it's an incident that basically has multiple patients, usually quite a few of them. But the main key is that the number of patients outnumber the number of responders to be able to handle those patients, okay? That's basically when we're going to implement this system right here, what we call the START system, triage START, okay? Basically, we need to find a way, this is a way for us to quickly assess a lot of patients in one area with a minimal amount of responders and categorize them on who needs help right away and who can wait until get help, right? Because we want to try to do the greatest good for the greatest number. And to do that, we have to play a hard role of categorizing people and prioritizing people and who gets treatment first and who's going to get treatment later. And that's a hard thing to do. I understand it's a hard thing to do because you want to help everybody. But it's just kind of the nature of the beast when you only have so many hands that can help, but you have a lot of patients that need to have issues addressed. Okay, so this is the system that we're going to use to do that. All right, it's the START system, and it's basically on a color-coded system. And there's several ways that you could do it. If you happen to have a kit, an actual triage kit that has these fancy tags, these are great. If you can invest in them, I believe you can buy them online if you need to. And these are great to keep in your CERT bag if you get them, okay? Because it makes it a little bit easier. But if you don't, you can use other things too, such as tape. You can use color tape, okay? And we'll talk about the colors here in a second. Or you can even use these little bands to tie on people's wrists if you needed to, or their ankles or whatever, okay? So let's talk about the colors and how we're going to designate that. So first we have green, and even on the tag we have green. And as you can see on the tag here, right, it says minor. That's going to be the people that nothing's really wrong with them too much. Their airway's open, they're conscious, they can respond to you, okay? They don't really have any kind of issues with them other than maybe minor cuts and scrapes. They're still mobile, they can walk. They could possibly even have maybe a broken finger or a broken arm, but they're still stable. They're stable patients. They're not gonna go into shock or in any kind of life-threatening danger to us. Okay, so that's what we're gonna do. We're gonna assess those patients, come on them, and we're gonna try to do this in less than 30 seconds to try to assess our patient, okay? And how do we determine whether they're green, yellow, red, or black? Okay, well first, like we said, the green was the minor. The yellow is going to be immediate. That's gonna be the next level up. These people aren't necessarily a life threat, immediate life threat of dying, but they do have some kind of severe injury and could possibly progress into something worse quickly. Okay. Next we have the red. We have the red, which is immediate. These are the people that need our attention right away. These are people that have possible breathing issues. They have possible arterial bleed issues. Level of consciousness issues where can't answer simple questions to you. They're confused. So that could indicate some kind of head trauma or injury. Those are the people that are going to get the red. And then, unfortunately, we also have the black. Okay, the black are the people that are already deceased on us, or they're at a point where they are getting ready to pretty much be deceased. Their vital signs and their stables, their situation is so severe that there's nothing really we can do for them in the field. And I know that sounds a little harsh, but like we said, we're trying to do the greatest good for the greatest number. Instead of concentrating all of on one patient that probably isn't going to make it, we can use that time to maybe save 3 more patients down the road. Okay? Okay, so how are we going to figure out how to categorize these people? All right, well, if you get, like I said, if you get one of these fancy cards, it actually tells you on them, on here, what you're going to do. Okay, so the START triage system. Basically, we're going to walk up to our patient. We're going to walk into a room or walk into the area that we're at. And one of the first things we want to do is try to get everybody out of there, out of the way that we can, okay? So the first thing we're going to do is ask somebody, be like, hello, can anybody hear my voice? If you can hear my voice, please come to me. And anybody that comes up this way, we call them the walking wounded. Those people will come up, and those people are going to get a green tag. They're going to move on to the triage area with a green tag. They could even possibly assist you if you needed to, if their injuries are not as minor, especially if some of them have some kind of medical training. Okay? So once we get those people cleared away and moved on to the triage area that we've set up, the triage treatment area, now we're going to go to the rest of the people that didn't come when we asked for people. And this is when the rest of it's going to come in. So we're going to walk on our patient, right? And we're going to use a system called RPM. R stands for respirations, P stands for perfusions, and M stands for mental status. So the first thing we're going to do is walk up and see if our patient is even breathing, okay? If they're breathing and they're good, then we can move on to the next section. If they're not breathing, that's a life-threatening injury that we want to address. We want to put them into the head tilt chin lift or into a jaw throat remover to open that airway and try to get them breathing again. We're going to make the maneuver that we're going to demonstrate. We demonstrated in another lesson. Attempt to open the airway. If we can get the airway open, great, we move on. If we can't get the airway open, we'll try again for the second time. If we can't get an airway open again, unfortunately, that's when we need to move on to another patient. They're going to get a black tag at that point. Okay? So let's assume our patient does have respirations. Yes. The next thing we're going to do is check the perfusion. Okay? That's that capillary refill that we talked about. Where we're going to press on the fingertip, and it's going to turn white. When we press on it and we let it go, it's going to be white, and it should turn back to its normal pink color within less than 2 seconds. If it does, great. We can move on to the mental status part. If it doesn't, then they're going to get a red tag. And they're going to check red, and they're going to turn it to immediate, okay? Next, we're going to check the mental status. If they got good mental status, we're going to ask them simple questions. Basic questions that everybody here in the United States should know. You can ask them, who's the President of the United States? They should have a proper answer for you. Ask them what year it is. They should know the proper answer for those answers, right? Basic questions that everybody should know. Don't ask them some complicated math question, okay? Ask them something just basic that every person in America should know. If they answer correctly, then that's great. And then they still have other injuries, broken leg, broken spine, but nothing life-threatening. At that point, we're going to give them a yellow. If they are negative to any one of these questions on the RPM system, they're going to get a red tag, okay? They're immediate. Something's very wrong with them, all right? And if they fail all of them, obviously they're going to get a black tag at that point, okay? And basically, all you're going to do after you made this assessment, you're going to tag that person. You're going to either put one of these fancy tags on them, use the tape, or use some kind of ribbon or some kind of marking. You can even write green across their shirt if you needed to. If that's all you had was a pen or a marker, write green, yellow, red. That's all you can do, then that's all you can do. But we need to find a way to tag these people so when they move into the treatment area, we can categorize them and spread them out into the different locations where they need to go. Okay? And that is going to pretty much sum it up on triage for us. Thank you.